Hello, everyone, and welcome back for another episode of Chamber Spotlight. I'm your host, Danielle Cordova, Marketing Manager at Chamber South, and today we're talking about something that affects so many families and how parents can support their children in managing stress and anxiety in the school environment. And today I'm joined by Dr. Presswood from Monarch who specializes in helping families and students navigate mental health and emotional wellness. So welcome, doctor.
Thank you for having me.
Of course. Thank you for being here. How are you today?
I'm great. Thank you.
Good. So, I think the first thing that I would love to talk about with you is recognizing the signs. Starting with awareness. And there are some parents out there who may not know what to look for. What are some common signs of anxiety or stress in children or even in teens when it comes to related to school?
Yeah, so that's a good question because anxiety can look different in different people, particularly in children. Kids don't really have the language to say, I'm anxious or I'm worried. They say, my stomach hurts or my head hurts, or they say, I'm really tired. So you might see that, particularly in younger children. Even point to the child is vomiting or maybe even wringing their hands or unable to sit down or unable to concentrate. So oftentimes ADHD and anxiety can be confusing because it looks the same in the school environment sometimes. It can go in many different directions. And that's the important thing for our parents to kind of listen to what their child is saying so they can pick up on the clues. If there's any concerns behaviorally, academically, it's really important to involve either the school counselor or a mental health professional so we can kind of weed out and give us a game plan. Because anything that has multiple causes has multiple solutions. So that's why it's really important to kind of work as a team to kind of look at what's going on with children in the school environment so we can begin to create solutions that are effective at home and in school.
And for teenagers, what would that look like?
Isolation is very common for people who have anxiety or maybe even behavioral changes. It could be decrease in activity. It could be, I've seen a lot of kids, particularly now, kind of gravitate towards online environments because it's less pressure socially. Even kind of falling in love with these online bots because those relationships are easier to control. They're more predictable, and it just becomes a better outlet for them immediately. But long term, it really cripples their social skills and their inability to kind of navigate the real world. So again, it's a really tight rope to walk. So that's why it's important to kind of, again, listen to what the kids are saying, but also kind of working with other people, like teachers and school staff and even parents, grandparents, or outside professionals if needed.
Wow, that's a lot of signs. I feel that a lot of people might have overlooked thinking their kid is, just wants to get out of class or not go to school or try to play hooky, but they might actually have anxiety. As someone who used to have anxiety, those are some of the symptoms I related to. My stomach would hurt. I would get chills. Sometimes I would sweat because I would be so nervous. But, we got it under control. I had a great support system and, great family to help out. So all of that does make the difference.
Yeah, and sleep is super duper important as well. Like recognizing that the child is sleeping or not sleeping or the quality of sleep are really big indicators. Because that can also, when sleep improves, we see behavioral moods and even anxiety improve, not necessarily go away, but improve.
Well, that's good to know. And, I think it's really important, as we mentioned, getting people involved and helping that child or that person who really needs it. And, one of those things I go into is creating a supportive environment. So once parents start recognizing those signs, what are some better ways that they can create a calming environment at home that helps their child manage the stress better?
Yeah, that's a really good question because we get this a lot in family therapy. I think adults conceptualize the world way different than kids do, and particularly in terms of time and pressure and stress.
Yes.
Things that may not be stressing to an adult can be very overwhelming to a child. And sometimes their sense of time is very different and a sense of urgency is very different. So one of the things, again, communication is always big.
Mm-hmm.
But another thing is being understanding that kids aren't perfect. And they're under a lot of pressure at school, particularly with testing and even social aspects, right?
Mm-hmm.
So in the school and the home environment, it's really important to have a routine, but also, again, be flexible in that routine. That's one thing you can do at home. Another thing is to create that space where they can tell you that they're experiencing these things at school, because a lot of kids are just afraid to say, hey, you know what, I'm really struggling, or I don't know what's going on with me, I just can't focus, because the parents sometimes can be dismissive, and I'm guilty too. I have children too. Like, just
It happens.
just focus on what you need to focus on, and
Yeah.
boots to the ground kind of thing. But honestly, that's not the best thing for all kids. So
Mm-hmm.
also another thing I found really, really effective is ensuring that kids are physically active, because like technology has kind of crippled that. And again, the sleeping is really, really important, because kids oftentimes do not get good quality sleep because they're focused on their phones or their tablets. And sometimes that's an easier thing for parents, just to give the kid a tablet or phone. But in the end, that could be really impacting how they're sleeping.
What have you noticed since technology? I feel when I was growing up, iPad just came out.
Yeah.
So, I would play games. It was I feel more innocent than what kids have access to now, because, it wasn't a big thing to always be on the iPad. It was, we would go maybe for road trips, watch a movie, play some games, but that was pretty much it.
Mm-hmm.
Now technology has evolved to the phone, the watch, the AirPods, and everything in between. What have you noticed with anxiety related to technology, and the changes that you've seen with kids who are more on their phones or on those social devices than those who are more active or less on the phone and such?
Yeah, I think technology has created this sense of I must have it now kind of thing, immediacy. And when
Mm-hmm.
kids don't get it, or even adults don't get it, they become like kind of not very regulated.
Mm-hmm.
Particularly even adults. I've seen adults who cannot not touch their phone for an hour. It becomes very, very because the phone has become a kind of a safety net.
Mm-hmm.
And in all honesty, sometimes we can't even navigate our world without technology. We need it. Schools are guilty of this too. I mean, a lot of the schools use reading programs or math programs that are on the tablet or online,
Mm-hmm.
and that encourage kids to be online, which again can be a good thing, but we have to create limits and boundaries. And this is again one of the reasons why, as parents, even as professionals, we need to be kind of mindful of what we're asking kids to do.
Yes, no, that's entirely true. And I was a substitute teacher prior to my role here at Chamber, and they use the tablet for everything.
Everything.
Notes, books, their books are online. And it is great because it is convenient to have one thing. Because I used to carry my math book, my history
It's a
book,
lot.
and
Yeah.
every book needed. So in that sense, it is convenient. But it is, it is sad to see them always on a screen,
Mm-hmm.
And, we did talk about some communication and connection. And, I love that communication is everything, especially when it comes to mental health.
Mm-hmm.
Communication plays a really big role. So my next question for you is, how can parents make it easier for their child to open up and talk about what they're feeling, especially when it comes to school anxiety? Because, some parents may not know how to have that
Yeah.
conversation, or some kids may not know how to express themselves. So what would be your tips and your advice on how parents can do that and open up that conversation?
Well, first tip would be, if they're really unsure what to do, is to kind of seek clarification from somebody who can give them some advice, because sometimes we're too close to the problem to kind of see the problem or see the issue.
Mm-hmm.
But the advice I give to a lot of parents is to understand that two things can be true at the same time, right?
Mm-hmm.
Kids can have a perception of what's going on, and so can adults. And it doesn't mean that one is right and one is wrong. It's just they're different. So kind of coaching parents on understanding and taking a step back, and seeing that, hey, I don't see it this way, but maybe my child sees it this way, and let me see where I can kind of maybe take their perspective a little bit. Not just saying that, kids can't manipulate the situation, because kids can do that. Of course, we all know that. But it is important to kind of listen to, hey, this has been going on for a minute. We noticed that there's some frustration going on. They don't like school anymore, and they used to enjoy playing sports or enjoy with their friends, and they're avoiding their friends. Really, we want to focus on really the quality of that relationship, and that's one of the ways you can do it.
That's really good for parents to know.
Yeah.
And for even myself, I have a niece,
Yeah.
and as someone who said before who struggled with anxiety at school, now I know and I have the tools to help her, or to not help my sister understand, hey, this is what it's like, And, speaking with school, we talked about collaborating with schools briefly, and, I think it's really important to communicate with the teachers, the school counselors, because they are with the child a majority of the day and a majority of the time that they're there. And what is the best way to approach that partnership?
Well, most schools have actually been proactive in doing this. Again, relying on technology, which is a good thing. They have these different communication tools. I think some use Clever, some use Class Dojo. A lot of schools really rely on Remind is another. I've seen they use a lot of those apps. Some schools have the robocalls. Some schools have that. But really, honestly, it's always good to have a personal relationship and meet the teacher, talk to the teacher. Even if you can't do it on school events, try to make that effort to kind of build that relationship with the teacher, because you don't want the only interaction with the teacher, the school being, hey, my kid's in trouble, or hey, my kid's failing, because that really doesn't even make the child feel good if the only time the teacher and the parents are talking, or the school and the parents are talking, is when the kid is kind of in trouble, right? We don't want to avoid that, because then again, the kid is going to even themselves avoid those connections because they are afraid that they're going to be in trouble, or they remind them when they're in trouble. That's
a good point. That is a really good point. If all you talk about is trouble, then the kid will always think they're doing something wrong. And, which is, I think it's also important for a child or parents even to have some self-care as well, because coping with all of this, I'm sure it can't be easy. It wasn't easy for me as someone who went through it. But, what is something that, parents can do to model healthy stress coping mechanisms and management with themselves to set the tone at home? I think that's a great question, because that is an issue we see a lot. If parents scream and yell, they often expect their kids not to do those things. But if we're screaming and yelling and that's how we're dysregulated and we model that, there is no other model for the child to do. So it's important that, yes, we're kind of mindful of how we talk to people, how we manage our own emotions. Even when we don't think the kids are watching, they are watching, right? They're listening, they're watching. The other thing we can do is apologize. When we're wrong and we know we did something wrong, is to, hey, recognize that we're not perfect, because a lot of kids are really arrested by the idea of being perfect. They have a lot of pressure on them. So when they kind of take a step back and the parents are apologizing, they realize, okay, well, maybe I can do that too. So that's one of the ways. Another one is like kind of managing our time. Again, we can't be on our phones all day and then tell our kids not to be on their phones all day. That's really not fair. In a kid's mind, that's not fair. In our mind, it's like, oh, as an adult, you're a child. But for a kid, they don't see it that way. They see it as, you do it, I should be able to do it kind of thing, because that's the way they perceive the world. So it's really, really important to be mindful of that. Whatever we're asking kids to do, we ourselves should be doing, at least in some degree. Wow. That is very true. And, for those who do struggle with anxiety, it's hard as a child to go through that, but I'm sure it's even harder for a parent to see their child go through that, absolutely. Especially since a lot of people don't know about the resources or where to turn and those things. Can you talk a little bit about how Monarch can help a child or a parent with the services and everything you guys have to offer? Yeah, absolutely. So one of the things that, most school mental health coordinators will kind of give you lots of resources, but we
partner with a lot of the mental health coordinators.
Mm-hmm.
One of the things that we can do is kind of assess if it is anxiety or if it's something else. That's really, really important because, again, anxiety, the behaviors that we see with anxiety can look like other things, right?
Mm-hmm.
It can cross over with depression or maybe cross over with ADHD. So we want to kind of like separate those things to determine. It also could be situational. It could be the school environment. So we kind of want to help you assess where that's at. That's the first thing we can do. Then we can provide counseling services to the family and to the child and even to the parents because honestly, being a parent is extremely overwhelming. And when your kid has an issue, oftentimes there's a lot of self-blame, but it really isn't your fault.
Mm-hmm.
It's logical to know that, but we don't feel that as parents, right? We feel when our kid does something wrong or something's bad, it's our fault. We feel it. We don't know it, but we feel it.
Mm-hmm.
And this is why it's important for parents to also be involved in therapeutic services as needed because we're not perfect either. And we put a lot of pressure on ourselves to be perfect. And we compare ourselves to other parents and other families. And that really isn't a good thing for us either. So we can help manage those emotions, kind of coach parents on what they're doing right and move them in a better direction and not focus on what they're doing incorrectly or what they've done bad. We want to focus on moving forward and helping them build a better family because it's progress over perfection. And that's what we want to help parents do.
I think that's really important to remember, progress over perfection,
Mm-hmm.
because, I feel like especially nowadays with social media, kids compare themselves to a lot of influencers,
Absolutely.
celebrities, or characters they may idolize.
Yes.
And, even I've seen even some moms, because I'm on social media, and I've even seen some moms compare themselves to other moms, like, yoga mom, super mom who does like 6 a.m.
Yeah, for sure.
workouts, takes the kids to go play baseball, and then cooks a perfect family meal. So I do resonate and see how a child can always compare themselves, but also how a parent can compare themselves even more.
Mm-hmm.
And I think it's great that you offer services for both child and parent
And family.
Mm-hmm. And I think it's, like, as you said, progress over perfection. It'll be a great way for them to get the help that they need to discover, what works best for them as a family, how they can help each other, and of course their communication styles. And I think we discussed a lot today on like helping the child and the family. But what would be your message or your advice to someone, child or parent, who's going through it right now, who has severe anxiety with school, a parent who's at their wits' ends, doesn't know what to do anymore, and, it doesn't feel like they see the light at the end of the tunnel? What would be your message to them if they're watching this?
Yeah, for sure. And I think the biggest thing is isolation and shame. When people feel they're alone and they feel guilty for how they feel, those things are barriers for them to moving forward. If you doubt yourself, there's another parent out there who doubts themselves. If your kid doubts themselves, there's another kid out there that doubts themselves. So you're not alone in feeling those. Those feelings are very normal, right? But it's also very normal to reach out for support, and it's okay to reach out for support. A lot of people are scared of therapy. They're scared of therapists because they think that we're getting in their head and like going to analyze them in a certain way. But the reality is we don't do that. What we do is we take what's already good about you and help you discover it and move forward and find other things that are good about you. But we're not there to tell you that you're a bad person or that focusing on all the negative things that you've done or will do or have done in life. We want to focus on, you're not alone. We're here to support you. Other people have those feelings too. And it will get better if we can connect. And that's what we want parents to understand and kids to understand, that, again, it feels lonely, but we're here to help you.
That's amazing. And I think, I've met Gadel and he's awesome. And, I've been really lucky to have met you now and to hear, your knowledge, your expertise, and your advice to these families who struggle, because a lot of kids do have anxiety nowadays. Yeah. Way more than when I was growing up. And, you see it everywhere, whether it's with school, work, socially, and in so many different ways. So, to be able to share your knowledge and your expertise and the services that you guys have at Monarch. Thank you. It's been an honor to have you here and
No,
to
thank
talk
you
with
for
you.
having us, because we think it's a really important issue, because again, most of the times we see our family referrals are something related to this, like similar to this, right? The
Of course.
kid's not doing well in school and the parents at their wits' end, and it's causing lots of issues. But we can help you, and if not us, we know somebody who can. So we definitely want to what's best for you and your family.
No, that's amazing. And this has been really insightful, and thank you so much for giving this advice, for helping parents and supporting the youth starts at home. And and conversations like this truly make a difference. So thank you so much for your time, doctor.
Thank you. I appreciate it.
And for anyone who would like to learn more about Monarch All Health and their resources they provide, we will have their information down below in our bio. And thank you so much for watching this episode of Chamber Spotlight, and I'll see you next time.